Hi, good afternoon, everybody. So, my name is Anthony. So, I'm a student from the respiratory care. So, before that, I will discuss some important details to you students. And then, first and foremost, I just want you guys know. Do you know what kids normally do every day with their normal activities, which seems very unnoticed? Can anybody tell me? So that's what we call breathing. So with breathing, which organ is responsible for breathing? So that's what we call lungs. So with your lungs, so we're gonna be discussing all about asthma. So before that, lungs is what we call part of our respiratory system. So it would allow you to take fresh air and breathe, and then at the same time, it would allow you to talk. So usually your lungs, you cannot even see your lungs, but you can actually feel them. So one of the things that you can notice about your lungs is first is you have your hands, put it over your chest. So once you take a deep breath in through your nose, so you've noticed me, so you sense that your chest would rise. So that's once you inhale. So after you inhale, try to release those air back from your nose or exhale, and you will notice that your chest would go back to its original size. So that's what you will notice the function and the purpose of our lungs. So do you know that lungs is very very big, that it would really take most the space inside, and is supported by different things such as the rib cage that would support you. So moving on, you can also divide your lungs into two, the left and the right, and then inside your lungs there are different quadrants or lobes. So here is the picture of your lungs. So as what I've said earlier, in the left side, this one is your lungs, and then the right side is on this one. So once you take a deep breath in, you will notice that you get air inside, and then until here in your trachea, windpipe, until it would reach inside your lungs. So once you take a deep breath in, you will notice to have your chest rise and then go back to its original size. So there are different disease or problems that our lungs encounter. So what I'm going to talk is all about asthma. So asthma is one of the common disease that we normally do, and it is even prevalent or even often in different age groups, such as from children up to adults. So, as what I've said earlier, it is also often starts during childhood up until adults. It mostly attack the passageway of air, and then it would make the air to be very narrow. So, as you've noticed here in the side, you see this circle, which is very big. So, once you take a deep breath in, this is what we call the normal airway. So, the air would go in and out in this hole very easy. So on this bottom side, as we've noticed this one, you notice that the hole is kind of shrink or constricted. So that's what happens when you have asthma. So once you have that very small hole, once you take a deep breath in, you will be having any difficulty in taking a deep breath, which would I will discuss later about the signs and symptoms. And then also about asthma, it is also be causing any breathing problems, and then it would cause your airways to be swollen, and some other times it would lead to some those gooey things inside. That's what we call mucus, where you'll often keep on coughing those out. And then some say when you have asthma, uh, it seems like you were breathing inside a straw. As you've noticed, that straw, it's a very tiny hole. So that's what usually asthma happens. So these are the signs and symptoms for asthma. So first is the difficulty in breathing. So usually difficulty in breathing would occur with or without exercise. Some would even happen like, for example, if you were playing with your friends outside and then suddenly you were gasping for air, or sudden you were trying to take a deep breath in, but you couldn't able to get some air. And then another thing is chest pain, where you feel that your chest is very, very heavy. So that would also occur. And then frequent coughing. Frequent coughing also is very, very common for asthma, in which once you keep on coughing, some other times during nighttime, and then most of the time when you cough, that's where you get rid of those what we call mucus, uh, like a gooey thing, different kinds of color, and then trouble speaking in sentences because your airways are very irritated, and then lastly is wheezing. So wheezing is one of the most common breath sounds, abnormal breath sounds that we hear when we have asthma. So I have here in the side one of the common breath sounds for asthma, wheezing. So as we can hear, it's kind of a squeaking sound. So wheezing is a whistling sound. So when you attempt to breathe, your airways become narrow or tight. So that's what you normally hear when you have asthma. So moving on. So what triggers asthma? Asthma triggers usually often occur like during exercise, as what I've said earlier, when you're having some any normal daily activities, or even playing with your friends outside. Allergies such as dust, outside from the grass, pollens, even pets, either dog or cats, and even cockroach. So which is why we don't recommend, especially to children, to have pets like beside them, or if they do have, as much as we can, we have to let the children be to avoid those pets. And then air irritants such as smoke from cigarette, charcoal grills during like you have picnic or anything like that, and then you have some fumes or even strong perfumes or odors, and then also other health conditions such as food allergies. Most of the common food allergies are like milk, peanuts, even seafoods like shrimp, and even eggs. And then weather permitted, it would also cure asthma when you encounter like very, very cold air or dry wind. And then emotions, when you feel like you're very, very happy, and then you're very ecstatic, and then you're very, very angry, or kind of anxiety. And then also when you're also yelling, it would also trigger asthma. So does asthma be prevented? Well, asthma cannot be prevented, but we can also reduce asthma attacks by understanding those triggers, and we should also avoid them at all times. So that's one of the triggers that I mentioned to you guys earlier. So there are certain medications and treatment where we can give to those asthma patients. So most of the time we give medications such as bronchodilators, and then with the bronchodilators there are two different ones such as quick relief, or we call those rescue medication, and then it would help you when open up your airways, and then control the symptoms when there are flare-ups, and then it would also usually done when your asthma would trigger. And then long term is what we call kind of a maintenance medication. This would help you have any few or milder attacks, and then also it would reduce inflammation. And then management for this is you could always have to control asthma by certain medications which the doctor would prescribe to you. So one of the management treatment, usually uh, medications is being given via nebulization or inhaler. So most also there's another thing that we can give is what we call an asthma action plan, in which the doctor would give it to you, kind of a form. So this asthma action plan is kind of like a traffic light sign where there are three different colors: the green, yellow, and the red. The green meaning you are doing fine, you're able to do some of the activities that you normally do, you don't have any triggers at all. And then with the yellow one is kind of worse. So it's kind of, you have to be very cautious about it, in which there's one of the symptoms of asthma that kind of trigger you already. And then lastly is the red one. It is urgent care, in which you really have to go to the hospital, inform your doctor. And then with the asthma action plan, most of the time you would also give peak flow meter, where you can assess the exhalation for that patient if it did make significant effect after medication or not. So this is what we call asthma action plan. So, and then another thing is we always have to give a flu vaccine, which is very, very important, especially during flu season. So on this picture on the side, this is what we usually give. This is one, what we call the inhaler. So as you've noticed, this child having an inhaler, this is not very, very easy to use, especially for children, because we have some protocols or step-by-step process on how to use this one and how to put this in the right appropriate manner. So normally when you're being prescribed by this one, uh, you're always being taught by the provider or some with the respiratory therapist on how to use the device and how to store them properly. And then the other one is what we call the nebulizer. The nebulizer is have a machine. You can either use it via mouth, sorry, or even a mask. And then this one is the medicine cup where we have to put those liquid medication. So with the this one is I can give you some daily activities for you to know how to set a or make a lung activity for you guys to know what's the purpose of the lung and what's its use. So these are the important materials needed. All you have to do is have an empty bottle container, a disposable one, and then a scissors, a rubber band, two pieces of balloons, straw, and a molding clay. Or if you don't have molding clay, you can use a dough. So in here, I'm gonna show the video. One of the things that I did and uploaded. So you will notice the lungs to inflate once you breathe, pull the balloon side. So that's one of the projects. So I hope you guys enjoy and thank you so much for your time.